Well, as we head into cold and flu season, how might things look differently for in-person workplaces, schools, daycares, and medical offices when people are sneezing, coughing, having a runny nose? Any symptoms like that, people might be more likely to be asked to stay home this year. Nina Sperano reports.
As we head into cold and flu season, you can expect things will be handled differently at workplaces, schools, daycares, and medical offices because of COVID. Anyone with symptoms like a runny nose or cough or sneezing will likely be asked to stay home.
So I think there's going to be a requirement for any of these symptoms for employee health at the workplace to take a larger role in screening patients, probably a lot more testing.
The head of a primary care clinic in Colorado talked about how people should handle these symptoms with COVID. Dr. Scott Joy recommends staying home for 24 hours when you have a cold without a fever. If you have a fever, isolate for up to 6 days or until you've been fever-free for a full 24 hours. If you're coughing or sneezing more than 4 times in an hour, you should probably stay home and see a doctor.
We haven't had a metric like that before, so we're going to experiment with that data point and see what it does to our workforce and our clinic infection control over this season.
Dr. Joy also reminds people to get the flu shot. A study in the New England Journal of Medicine found people who got the vaccine had 25% fewer episodes of upper respiratory infections than those who didn't. That means fewer sick days from work and fewer doctor visits. The hope is that COVID measures like hand washing, mask wearing, and watching your distance will lead to fewer respiratory infections overall. But if you experience those symptoms, you may be directed to urgent care centers instead. The idea is to keep doctors' offices sterile so people with chronic conditions and other issues feel safe coming in to see their primary care physician. I'm Nina Sperano, NBC 26.